everyone. In the previous session, we discussed about medical imaging devices part 1. In today's session, we are going to discuss medical imaging devices part 2. Under this medical imaging devices part 2, we are going to discuss three major devices: MRI, PET and SPECT. First is MRI or magnetic resonance imaging. It is a non-invasive method for mapping internal structures within the body, which uses non-ionizing electromagnetic radiation and employs radio frequency radiation in the presence of an carefully controlled magnetic field to produce high quality cross-sectional images of a body in any plane. Basic principle of MRI is NMR. The basis of MRI is directional magnetic field or moment associated with charged particles in motion. The concept behind nuclear magnetic resonance is that many nuclei have spin and all nuclei are electrically charged. When an external magnetic field is applied, energy transfer is possible between the base energy and the higher energy level. The energy transfer takes place at a wavelength corresponding to the radio frequency, and when the spin returns to its base level, the energy is emitted at the same frequency. MRI machine. 4 basic steps are involved in getting an MRI image. They are placing the patient in the magnet, sending radio frequency signals by coil, receiving signals from the patient by coil, and transforming the signals into image by complex processes in the computer. Components of MRI. The major components of an MRI scanner are main magnet, which provides a uniform magnetic field of about 0.5 to 3.5 Tesla to set the stage. The types of magnets used are permanent magnets, superconducting magnets, resistive magnets, and gradient magnets. Gradient coils for positional informations, RF transceiver to excite and receive signals, digitizer in order to convert received analog signals to digital signals, pulse sequencer which controls the timings of gradients, RF transceiver and digitizer, and finally computer which uses FFT to form images and display results, etc. This diagram shows the inner working components of an MRI scanner. They are RF transmitter and receiver, which helps in sending and receiving radio signals, main magnet which helps in create a uniform magnetic field, and X, Y and Z magnetic coils to create varying magnetic field at different axes. Proton as a small magnet. Body has many such atoms that can act as a good MR nuclei. Hydrogen atom is not only positively charged, but it also possesses a angular momentum. MR utilizes this magnetic spin property of a hydrogen atom in order to elicit images. There is an electric charge on the surface of the proton, thus creating a small current loop generating a magnetic moment M. The proton also has a mass, thereby generating an angular momentum J when it is spinning. Thus the proton magnet is different from the normal bar magnet. T1, T2 relaxation. When RF pulse is stopped, higher energy gained by the proton is retransmitted and hydrogen nuclei relax in two mechanisms. T1 or spin lattice relaxation, by which original magnetization begins to recover. T2 or spin-spin relaxation, by which magnetization in XY plane begins to decay towards zero in an exponential fashion. It is due to incoherence of H nuclei. Applications. MRI is a useful diagnostic tool in characterizing a variety of CNS infections. Especially, it helps in detection and diagnosis of CNS tuberculosis, meningitis, and brain abscess. It also helps in detection of lesions. Before getting into next two devices, PET and SPECT, we must know what is nuclear medicine. Nuclear medicine is a very unique because it helps doctors to know how our body is functioning. This type of imaging techniques takes a small amount of radioactive pharmaceuticals and follow their path and progress through our body. X-rays and CT scans will show how something in our body looks, but nuclear medicine shows how our body actually works. PET or positron emission tomography is a non-invasive diagnostic imaging technique to provide information about the metabolic activity of cells in a human body. It was developed in the year 1970s and it is the first scanning method to provide functional information about the brain. Positron is an antimatter electron and it is identical in mass but has a charge opposite of about +1. Positron can be produced in a number of ways and in PET it is developed by nuclear decay. PET machine. There are four major components in a PET scanner. They are the gantry that houses the detection apparatus with a large patient port, subject table that moves in and out of a patient port allowing complete scan, the detector or camera system for capturing the images, and a computer system that processes. Working. Before starting a PET scan, a radioactive substance is produced with a machine called cyclotron and is attached to a natural body compound, most commonly glucose. Once this compound is administered into a patient, radioactivity localizes in the appropriate areas and it is captured by the PET scanner. Different colors or degrees of brightness on a PET image represents different levels of tissues or organs functions. For example, normal tissues uses glucose for energy. It accumulates some amount of tagged glucose and it is shown up on the PET image. However, cancerous tissues absorbs more glucose than the normal tissues and it appears more brighter than the normal tissues on the PET image. The nucleus of the radioisotope emits a positron, positively charged electron. This in turn collides with the electron in the tissue and in the process converts mass into energy in the form of two photons. The PET scanner with the scintillation crystals placed around the subject observes these photons. The observed photons are in turn converted into electrical signals by the scintillation camera. Applications. PET scan is highly used in patients with affected conditions in the brain, heart, certain kind of cancers, Alzheimer's disease and some neurological disorders. In this slide, a comparison between a normal and affected tissues in the PET images is shown. The first image depicts a comparison between a normal brain and an seizure affected brain of a 9-year-old female is shown. In the second image depicts a comparison between a heart that is affected by myocardial infarction and a normal heart is shown. Next is SPECT scan or single photon emission computed tomography. SPECT shows how blood flows in arteries and veins in a human body. SPECT scan differs from the PET scan with the point that tracer remains in the bloodstream instead of being absorbed by the tissues. SPECT can detect reduced blood flow in any region in a body. SPECT machine. Single photon emission computed tomography provides three-dimensional image information about distribution of radiopharmaceuticals in a patient for diagnostic purposes by combining conventional scintigraphic and computed tomographic methods. 3D images with high contrast and high image quality of three-dimensional is being provided by SPECT scan. Components of a SPECT. There are major components in a SPECT machine. They are collimators, detectors, pulse height analyzers, photo multiplier tube, position logic circuits, and data analysis computer. Working of a SPECT machine. Radiopharmaceuticals are injected into the patient's body. They travel in the bloodstream and concentrates in the region of interest. There it decays by emitting gamma rays. The emitted gamma rays are detected by the gamma camera head of the SPECT machine. The gamma rays are collimated by the collimator in order to reduce scattering and improve image quality. The collimated gamma rays hits the detector, which is converted into visible light. The visible light travels through the photo multiplier tube and is getting converted into electrons. The electrons are used for image formation. These electrons are detected by position logic circuits, which decodes the original position of the photon, and pulse height analyzer, which decodes the energy of the emitted electron. This information is shared to the digital circuit in a computer, which uses algorithms to reconstruct the image. Applications of SPECT include brain imaging, heart imaging, detection of tumors in the cancer patients at the early stage, bone scans. The common use of SPECT is to investigate abnormal metabolite bone activities, etc. Now we have come to the end of the session. Hope you all understood about medical imaging devices part 2, under which we discussed MRI, SPECT and PET. In the next session we will discuss about medical imaging devices part 3. Thank you.